Hey guys, it's Dave. Coming to you today with a request from one of our live viewers regarding NAFLD, or non-alcoholic fatty liver disease. It's a silent liver disease, meaning generally there are no symptoms. If you do see anything, it might be just like a chronic fatigue and maybe a little swelling or pain or discomfort in the right abdomen area. There are actually two types of fatty liver disease, one being the NAFLD, which is the milder of the two. Only 10 to 20% of all Americans will have that. What happens is it can progress into NASH, which is non-alcoholic steatohepatitis. With that, there can be liver damage that can progress into actual cirrhosis. And if you do get NASH, you can see things again like fatigue, abdominal distension. You can see yellowing of the eyes, the skin, redness in the palms, and also you can develop blood vessels which are actually coming out like spider veins on top of the skin as well. And you also generally see with NASH, you'll see a chronic itching. You'll just be itching all the time, as well as some weight loss. Basically, how you find out about the disease, because it is a silent disease, is you will have some of the symptoms that generally run with that, like obesity, diabetes, and they'll do a test on just a general blood test, and some things will show up like inflammation, and your liver function test may be off. At this point, they can go in and do some imaging scans of the liver and actually see either scarring or the fatty deposits on the liver. From there, they may want to do a biopsy of the liver to see if it is actually had some damage to it, if it is actually fatty deposits as well. Causes are really unknown as to why people do develop fatty liver disease. However, there are a lot of things that people with the disease have in common. Number one being obesity. Then, like I said, diabetics or pre-diabetics are more prone to it. People with high cholesterol or have a lot of fat in their diet, high triglycerides along with that, can be prone to it. People with high blood pressure, insulin-resistant patients or people with metabolic syndrome, ladies with POS, people that are hypothyroid or have sleep apnea. One of the things that you generally see in common with a lot of the disease states that I just mentioned are people that are overweight. If you can take off the weight, you can actually help yourself with a lot of those symptoms like high blood pressure, diabetes, sleep apnea. Those can all actually be decreased or in a lot of cases go away. So what are you looking at for treatment with fatty liver disease? Well, the main treatment is take off the weight. If you can lose 10% of your weight, it will greatly help all aspects of your health. The other thing is, if you're a diabetic, control your diabetes. Get your blood sugars, daily blood sugars down into normal range and get that A1C down where you want it to be. Of course, they say less than 7, but ideally, if you can be less than 6, even better. And then as well, avoid alcohol, because anytime you're drinking alcohol, it's hurting your liver. So try and really get the alcohol out of your diet and stick with things like exercise. If you can exercise, that will help decrease inflammation. It'll help take off the weight. So that is a benefit. There are some things with NASH. As I said, the NAFLD progresses into NASH. That's where the liver damage occurs. However, if you can get on top of it, sometimes that liver damage will stop and even reverse. With that, you may need to be on medication to help lower your cholesterol. So maybe a statin like Lipitor or Zocor, which is atorvastatin or simvastatin. And then, of course, get your diabetes totally under control and lower your blood pressure. So they may have to put you on a blood pressure medication as well. Now, there have been a few studies that say vitamin E helps. However, I want you to be aware that vitamin E has also been linked to all-cause mortality or death, and in men can lead to prostate cancer or a greater risk of prostate cancer. So look at maybe some other antioxidants that will help decrease inflammation, not so much vitamin E. They need to do more studies on that. But if you eat a healthy diet, rich in fiber, vegetables, and fruits, whole grains, and good fats like olive oil, that can help out to reduce some of the symptoms that you have with fatty liver disease, as well as get your diet under control so you can lose some weight. Exercise is, again, very important, like I said. And the last thing that I like, studies have actually shown that 2 cups of coffee a day can help decrease liver damage. So if you're a coffee drinker, you're heading in the right direction. If you're not, you might consider it. But remember that coffee with caffeine can increase your blood pressure. And if you're already somebody who has high blood pressure, talk to your medical provider about that.